Good morning, everyone. So today I want to tell you about endocrine disruptors, obesity, and diabetes. So many of you have probably noticed that obesity seems to be on the rise. We're seeing more children and adults and teenagers who appear to be overweight. Now, this isn't just limited to the United States. This is actually occurring in all sorts of countries, including countries that we have until very recently considered the only eating problem may be undernutrition. In fact, obesity and overweight sometimes are associated with undernutrition because although some people are eating more calories, the nutrient content is very poor. So I've just talked a little bit about diet as a risk factor, and I'm sure that we all can relate to the tough choices between those pastries outside and a nice piece of fruit. Physical activity is also cited as a potential cause of obesity and diabetes. And we also know that genetics may be playing a role. So that's kind of a more complicated story because we don't evolve our genes very rapidly. They certainly don't evolve within a generation or two, which is the time span we've really seen these obesity and diabetes skyrocket. And so the idea behind the genetics piece of this is that you might have underlying genetics that are very susceptible to the physical activity going down and the diet being poor and excessive. But what if environmental chemicals could be contributing to the obesity and the diabetes? So we know that the endocrine system and its disruption is important in metabolism. Dr. Galvez just told you guys that body weight was an important determinant of the timing of puberty. You may have experienced this firsthand if you happen to know a young gymnast. Gymnasts tend to go through puberty a little bit later because they are so lean. Well, it turns out that also during puberty, there is a normal, healthy surge of insulin that occurs during the later part of puberty, right around the time of menses. So there is an intimate connection between the sex hormones that we've been thinking about and the metabolism system. Another great example of that is menopause. Once a woman goes through menopause, her risk of obesity and diabetes and a lot of other metabolic diseases really goes up. And that's independent of age, so it's not simply just a factor of age. So one thing that's particularly alarming is a lot of the chemicals are stored in fat, which means these chemicals basically have front row seats to cause damage to fat tissue. In this field, that's really an emerging field, we have this term that we've called obesogens. And the concept is that any chemical that might promote fat accumulation could be called an obesogen. So I'd like to focus primarily on the early life origins of obesity, focusing on early life exposures to chemicals. And I want to talk to you a little bit about what that means. So you can visualize an obesogen acting on a mother or on a child. How would it act on a mother? Well, the obesogen could directly interact with the pregnant woman and influence the fetus, or it could influence the eggs before she's even become pregnant, or while she's lactating, the obesogen could be stored in the milk, and because milk is very fatty, it could be transferred to the baby that way. So these are all three different ways that these obesogen chemicals could interact ultimately with the baby, even though they have to do with a maternal exposure. So as it turns out, when we think about the endocrine system, it usually involves talk between different tissues and organs at a distance. So obesity, although I've mentioned fat, is really also involving the brain, the liver, fat tissue itself, and skeletal tissue. And also underneath the liver here is the pancreas. So just from even the first couple of days after fertilization, these organs are already starting to take form. So the outer layer of cells becomes the brain ultimately, and the innermost layer of cells becomes the liver and the pancreas. And these middle cells become your skeletal muscle and your adipose tissue. So why am I telling you all these details? Well, when we think about developmental exposures, the risk is really an exposure that's occurring while that tissue is still forming. So, as soon as the egg has enough of these cells that are going to go on to become these tissues, any exposure that occurs in those cells could impact those tissues for the rest of that baby's life. And what's really interesting is some of these are not done forming even when the baby's born. So if you think about your teenagers and how hard you work to get through to them, have mercy on them because their brains aren't actually done forming yet. So you know that actually the brain isn't done forming maybe until late teen years. And the adipose tissue itself also isn't done forming yet. And so even after birth, there's still this risk. So now I want to tell you a few examples of chemicals that are associated with obesity and diabetes. So we looked at this series of different studies to see whether or not smoking during pregnancy might increase your risk of obesity, overweight, and also diabetes in the blue. And you can see most of the lines are in black and green over here. So let me help you understand what you're looking at. That red line means there's no association between the chemicals and the diseases. Anything to the right of that line means that that prenatal smoking increases the risk of obesity and overweight or diabetes. Anything to the left would mean that this smoking exposure actually would protect against those diseases. Now you can see if you look over there, even if you don't want to look at the details, just a quick look shows you that everything pretty much is on the right-hand side, which is what I just told you is associated with an increased risk. And in these studies in aggregate, you can find that there's an increased risk by about 50 to 60% that a child will be overweight or obese if her mother smoked prenatally. So this isn't just about little kids. This risk also extends to teenagers. So in a study last year, they looked at non-exposed teenagers and exposed teenagers, and they looked at it in terms of puberty. Because as I just mentioned, and as Dr. Galvez mentioned, we know that puberty and body mass are very tightly related. So you can see that in early puberty, there's not much of an effect of the smoking. But by late puberty, her mom's prenatal smoking makes it so that she has an increased body size and an increase in body fat itself. And you can see that by the big black bars over here. So other chemicals are also associated with increased risks of obesity, and we've talked before about PCBs and DDT and DDE. I'll just remind you briefly about them. So PCBs were previously used as insulators and as flame retardants. And DDT is an old pesticide that's only used in areas where malaria is a concern. And DDE is its metabolite. So these chemicals are no longer used in commerce, certainly not in Spain. And yet, these are measurable in the umbilical cords of Spanish children because these are stored in fat and they stay in our food chain. So as it turns out, that the levels found in those umbilical cords of these little infants, it was directly associated with the obesity in those children when they were 6 years old. So I've shown you here a picture of her eating a hamburger. Now typically if you walked past this little girl, you would think, oh, she's obese because she eats too much hamburger. Well, maybe that's true. Perhaps it's true because that hamburger has animal fat in it that stores these very same chemicals. So I also want to show you that this has been shown in a different animal, in mice, because I think it's important when we're questioning an emerging field to see, is this happening in more than one species? It gives us more confidence in the observations we've seen in humans. So this is a pretty fascinating study here. In International Agency for Cancer wanted to figure out if DDT causes a risk of cancer. So they fed mice DDT, and then they fed the babies DDT. So this is the babies, the male generation, and this is time down here. This is aging. And over here is how much they weigh. This line down here at the bottom is the line for no exposure to DDT. You can see that just like humans, as you age, you get heavier. And then maybe when you get older, your weight goes down because they're getting a little frail, just like we do. But what's really striking about this graph is as you go up in the dose ranges of DDT that they tested for cancer, you can see they're all clustered much higher above the untreated mice. So that these mice were heavier all through their life because of these exposures to DDT. So there are other chemicals that we've talked about today that are probably developmental obesogens also, but we don't really have very many human studies to tell you about. But DES, which several people have talked about today, it turns out that when somebody gave DES prenatally to mice, those mice had 40% of their body mass that was all fat. Now the untreated mice at that same age were only 30% body fat, so a whole extra 10% of their body weight was fat when they were exposed just prenatally to DES. Also BPA, we've talked about that a couple of times already today. The prenatal exposure to BPA in animal studies has also been associated with increases in body weight. PFOA is an active ingredient in Teflon. Its chemical relatives are found in things like Gore-Tex liners. PFOA, when given prenatally to mice at low levels, increase their body weights and their fat mass throughout their life, and also elevated their insulin, which suggests they might have been at increased risk of diabetes also. Now, tributyl tin is a marine antifoulant. Antifoulants are frequently used as paints. And tributyl tin is actually one of the few examples I've seen in the experimental literature where a pubertal exposure, as opposed to a prenatal exposure, is associated with increased risks of obesity. So the mice that were exposed to this during puberty had increased body weights, increased body fats, increased fatty liver, and also increased insulin levels. So I mentioned very briefly in my slide when I was telling you about prenatal smoking that there was also maybe a link to diabetes. I'd like to tell you a little bit more about some of the studies that are coming out relating to chemical exposures and diabetes risks now. So there was a study done in over 30,000 licensed pesticides applicators, and they looked at a whole series of chemicals. Now, this study has been going on for a long time, so a number of these chemicals are luckily no longer in use. We're still looking at the same type of drawing I showed you before, where that red line means that there's no association, and anything to the right of it means that those chemicals are associated with an increased risk of diabetes. And you can see just clearly glancing at it that most everything appears to be on the right-hand side. Now, the good news is that many of these chemicals are no longer in use. They're voluntarily phased out or they are banned. But dichlorvos right here is actively used still. So I told you earlier that what I'm really interested in is those early life exposures. And so one thing that I found was particularly interesting is in the same study, they looked at whether or not the spouse of the worker at these agricultural settings had an increased risk of gestational diabetes. And again, the same story where that line going down represents no association. Anything to the left means protective. Anything to the right means those chemicals increase risk of gestational diabetes. Now, the red ones are highlighted to show you those are the ones that statistics say are significant. And clearly you can see that while not everything is as clear to the right as it has been in some other examples, The trend is still largely the same as we've seen previously, where the bulk of that estimation of the risk linking pesticides to gestational diabetes all lies on the right-hand side. So luckily, again, most of these chemicals are also not actively in use. However, atrazine, this red one right here, is still the most commonly used herbicide worldwide. And we know that gestational diabetes increases risk of obesity and diabetes in children, in addition to increasing the risk of diabetes in the mothers themselves. And so although this is not directly relating to the offspring, it's still very concerning about the quality of their health. So just a few more pieces of information about the diabetes links to these chemicals. Trans-nonachlor is a fat-soluble pesticide, and you can see that across various studies, there's an increased risk of diabetes. DDE, again, that DDT metabolite, is also associated with increased risk of diabetes. And then PCBs, those old industrial flame retardants and insulators, are also associated with an increased risk of diabetes. So a lot of the chemicals I've talked to you about today I focused on because these are the chemicals that get stored in body fat. And these chemicals, fortunately for us in some ways, are frequently not used commercially any longer. So what that means is that it's not as easy as a consumer decision to, for instance, avoid buying certain consumer products like toys and nail polishes. But you can do other things. So one thing that's really obvious, and it's a message you've been hearing for a very long time, is to avoid smoking cigarettes, particularly if you're pregnant. Another thing that's really important, and it might surprise you that I'm saying this, is by reducing your climate footprint, you can have a positive impact on our exposure to these chemicals. The reason is because these chemicals that I've talked about today, they are not completely in the air, but they like to travel in the air a little bit. And so as it turns out, on a global picture, these chemicals rise into the air, and then as the air cools, like over the polar ice caps, these chemicals fall back down onto the earth, which means a lot of these chemicals have been sequestered away from us and protecting us in the polar ice caps themselves. So as they're melting, these chemicals are starting to be reintroduced into our environment. And this first became apparent in studies of whale blubber in the Baltic Sea. And they're starting to see the levels of these chemicals going up. So if you want to make sure that these chemicals do not reappear in your lives, one thing you can do is to work on reducing your climate footprint. Another thing that you can do, I didn't talk a lot about it, but there are some pesticides in here that are still in use and are associated with an increased risk of diabetes and obesity. So you can consider using integrated pest management. That's a physical barrier type of alternative to pest control, where basically you seal cracks around your house and put lids on your garbage cans rather than spraying chemicals in your home. And finally, I want to emphasize that you should consider eating low on the food chain. Because these chemicals are stored in fat, the levels in a given piece of food are going to be higher if that's a piece of food that has a lot of fat on it, and if it's a piece of food that came from an animal that ate an animal, such as, for instance, a high food chain fish like tuna, maybe. So when you're thinking about these things, ask yourself, what is the food I'm eating, how high up on the food chain it is, because the amount of pollutants you're going to find in that fat is going to be very closely related to the answer to that question. Thank you for your attention.